Hi, all. Welcome back to another episode of Doctors Go Live. I'm Nina Shahril Khan, your host, and today we are going to be talking about emergency signs you should not ignore. So, who's tuning in? Where are you tuning in from? How is everybody doing? Let us know in the comment section. And if you have some interesting stories on emergency situations, please do share with us in the comment section as well. Okay. And of course, what would you like to know in today's episode of Emergency Signs You Should Not Ignore? Do let us know in the comments section as well. All right. In the meantime, who is excited to win some prizes? Let us know in the comment section, because if you share this video out, you get to take part in our Doctors Go Live quiz, which is happening right at the end of the Q&A with our special guest today, where you get to win some really exciting prizes. Let us know in the comments. Be sure to stay tuned because you get to win a laptop bag. So who wants to win a laptop bag? Let us know in the comments. So stay tuned all the way till the end because you might just be our lucky winner. Now, all this is happening right here on Doctors Go Live with me, Nina, and our special guest for today. Now, today we're going to be diving into a topic that can quite literally save a life, maybe even yours. All right. Now, we all get that aches and pains from time to time, but how do we know when it's something serious? Chest tightness, sudden dizziness, high fever in children. When should we drop everything and head straight to the ER? That is the question we're going to answer today. To help us understand red flags we should not ignore, we're going to be joined by consultant emergency physician from Columbia Asia Hospital, PJ, Dr. Jonathan Yeap. Okay, Dr. Jonathan will be taking us through the critical signs, what to do in emergency, and how to stay calm when seconds count. All right, so grab your notebook or just pay extra close attention and be sure to stay until the end for our quiz section because you might just win that laptop back. All right, now if you know anyone who this information will be super useful, please be sure to tag them because you could definitely make a difference to people out there today. So for today's topic, let's take a look at this video.
In an emergency, every second counts. But too often, people delay going to emergency department. Why? It's either they are unsure of the warning sign or they are worried that they are overreacting. And this delay can cost life. Learning how to recognize emergency symptoms like chest pain, shortness of breath, seizures, high fever in young children can make a difference between life and death. And we know that preparedness during emergency is the best response. Hi, I'm Dr. Jonathan Yeap. I'm consultant emergency physician, Columbia Asia Hospital, Petaling Jaya. Catch me on the next episode of Dr. Go Live, where I walk you through on the most critical symptoms, when to go to emergency department, and how to react while waiting for help. It's all happening on this Wednesday, 9th of July at 3 p.m. Don't miss it. These tips can save a life.
Welcome back. If you have just joined us, you are watching Doctors Go Live with me, Nina Shahril Khan, and today we are going to look into emergency signs that you should not ignore. Now, here to share some life-saving tips on when to rush to the ER because we don't want to be over, right? Kind of thing. And when to stay calm, please welcome our guest for today, Dr. Jonathan Yeap, consultant emergency physician from Columbia Asia Hospital, Petaling Jaya. Please welcome Dr. Jonathan. Dr. Jonathan, thanks for joining us today.
Oh, hi.
Okay.
Hi, thank you for inviting me.
No problem. What you said is so true because I think a lot of the times we think we're overreacting, right? So we kind of tend to think, oh, it's just a suck it. Or so I think this is a really, really interesting episode that we're going to have today, right, Doc?
Yes.
Okay, cool. Now, before we go to the Q&A with Doc, a couple of reminders right at the end of the show, we have our Doctors Go Live quiz. So be sure to listen to everything Dr. Jonathan has to share because you could win some laptop bags. Now, if you have any questions as well, please let us know in the comments section at any time, and we're going to address it right at the end, all right? Right, Doc, are you ready? Let's get into it.
Okay.
Okay, cool. So before we start, yeah, Doc, could you tell us a little bit about yourself? What inspired you? How did you get into medicine, and what inspired you to pursue emergency medicine? I guess.
Okay. So I'm currently the consultant emergency physician in Columbia Asia, Petaling Jaya. So I completed my MBBS in Melaka Manipal Medical College in 2005. So then I started my housemanship in Hospital Kuala Lumpur in around 2006. So I finished at that time. It was like 1 year housemanship. Compared to currently, it's like 2 years of housemanship. So after that, then I completed like 4 posting there. Then I managed to get my posting to as a medical officer in Hospital Selayang. So I was there in Selayang from 2008 onwards until I joined my master in University Malaya in 2011, and I graduated at 2015 in University Malaya. So I went back to Hospital Selayang for my gazettement and was working there. And in 2018, I joined Columbia Asia Petaling Jaya, and so this is my, I think, 7 years in Columbia Asia PJ. So I'm here till now. So yeah, so this about myself. So
Mm-hmm.
what I actually do in emergency is that usually I will need to lead my team, especially on the life-saving intervention to all my patients. So we do see a lot of different variety of patients. Usually we term this as from womb to tomb. So from pregnant lady, newborn babies, children, small children, older adult, geriatric patient, and even patient with accident, major polytrauma patient. So we do see all these patients, and this type of patient, they come in a different severity group. For example, like it can be very mild, like they come to you with rashes, or at 3 o'clock morning, they tell you that they cannot sleep at night, to like semi-critical patient, maybe trauma patient with fractures on their leg, femur fractures, or hand fractures, to more life-threatening condition like heart attack, stroke, or they have cardiac arrest that we need to do resuscitation for them. So we one of the main thing in emergency is that we want to triage them appropriate to their severity, so that they get the right treatment at the right place at the right time. So this is one of the things that we do. So yeah. Another thing, just now you asked me about why do I pursue emergency medicine, right?
Yes.
So is one of the things that I choose to become a doctor is that I wanted to save more life, help more people. So during my emergency rotation, so I found a place where I can help the most number of people, because it's busy, and
Mm-hmm.
then and save more life at that rotation as well, at that posting. So especially when they need us the most, because in emergency sometimes they are very critical, they are very ill, so they need people to help them. So so when I was in emergency, I found that it's very satisfying. So it's very difficult to tell the emotion I have. It is like very words cannot describe it. The sense of satisfaction when you're able to save life and help
Mm-hmm.
people. So besides that, also I also like the emergency environment, which is very fast paced, where I need to have critical thinking and need to make a decisive decision
Mm-hmm.
in seconds to help the patient. So this the two reasons that why I choose emergency medicine as my specialty.
I think you don't need words to describe. I think we can tell how excited you are just from the way that you're talking, correct or not? Let us know. How many of you guys, if emergency, you want to go see Dr. Jonathan? Let us know in the comments. So thank you, Doc, for sharing with us. Another question before we start is, why is it important that we have this conversation about emergency signs? What is it that you know that people out there don't know and you want them to know? Why is it important we have this episode today?
So, so why we have, because it's important that you have a early recognition of these emergency symptoms. Like I mentioned earlier in the video,
Mm.
if you have chest pain, difficulty breathing, seizures, or severe headache, so these are some of the warning signs that you shouldn't
Dilly
ignore
dally.
it. Yes, correct. So with that, if you have all these emergency symptoms, you should present timely to emergency department to seek help, because all this by presenting in a timely manner, you can actually save your life as well. So so a lot of people, they delay because they are worried, hey, maybe the symptoms is not severe enough, or
Mm-hmm.
they are worried that they are bothering the doctors. Like I'm sure some people here in this live that will agree that some of your friends or family member may say, hey, let's don't go to weekend to hospital because they got lack of doctors, so we might be contributing to the overcrowding. It's better that we go on
So how many of
weekday
you
where
guys
there's more
feel like that?
doctors.
Yeah. How many of you guys feel like that? Let us know in the comment section. Yeah. So you were saying, Doc?
Yeah. So because of that, sometimes they might delay going to emergency department, and this can be potentially harmful and cause and even sometimes can cause death to the person because they delay in going to the
Okay.
hospital.
Okay. So your advice is, if you know, if something is up, go to the emergency. Please don't think that you're bothering the doctor or you're taking up space. Is that what you're saying, Doc?
Yes, correct.
Okay. Okay,
So
got it.
yeah,
We'll get more into it as we go in the Q&A, right, Doc?
yes.
Okay, right. So, are there any common misconceptions about emergency medicine that you often encounter? I think we covered one. Don't bother the doctor. What do we need to know about this?
So sometimes, like I mentioned just now, they assume that it's not so serious. For example, like they can have just mild dizziness when they stand up. So you say, oh, this one might be my vertigo. But sometimes we do see patient with stroke have the similar symptoms. So if you have acute stroke, you need to actually present to the hospital as soon as possible. Another
Mm-hmm.
example, maybe if the person have mild chest discomfort, they say, never mind, I just wait for a while, might be due to heartburn. So if it's really a heart attack, it's very time sensitive. So you need to actually present yourself early to hospital so that we can help you and save your life. So sometimes
Okay.
don't ignore all these small symptoms, because it can be a warning sign for potential more severe life-threatening condition.
Okay, got it. So that means don't ignore even the small symptoms. It's important. Yeah. Okay.
Yeah.
Well, I guess we can start right now. So let's begin. Let's look at some slides. We can have the slides on. So, what is this slide about? Yeah, Doc?
Okay, so I wanted to share that this is the statistic in 2024 they published. 2025 they haven't published yet. So if you see the number one cause of death here is actually pneumonia, which is account about 15.2%. So prior to this is always ischemic heart attack, ischemic heart disease, ischemic
Mm-hmm.
heart attack, which is the number one. So in 2023, I think it might be due to the COVID-19 pandemic after that. So there are more people that actually having infection. So pneumonia have actually become the number one cause of death in Malaysia, followed by ischemic heart disease, also roughly about 15%. And then the next one will be actually cerebral vascular disease, which is your stroke. And then the fourth one, road traffic accident, which account about around 3%. So all this, why we want to know this is that if you know this is the major cause of death, so if we know the warning sign, the emergency symptoms of each of these disease, then we can help ourselves to actually present earlier to emergency department, to hospital, so that the doctor can help you and can save your life as well.
Okay, got it. I think that's a very informative slide. Yeah, Doc. Thanks a lot. Okay, so now, so let's dive in. What would be the top emergency signs we should not ignore? So, what are these slides? This is what we're going to be covering today, right, Doc?
Yes, correct. So
Okay.
it's important. This 10 emergency warning sign or symptoms will actually help you to present earlier to emergency department. And these are some of the symptoms that can cause potentially life-threatening condition that if you do not rule it out early, then it can cause harm or even death to the patient.
Okay, got it. Let's go to. Oh, okay. So here are the 10 emergency signs. Is it, Doc?
Yes, correct. So these are the 10 emergency warning sign or symptoms. Number one is chest pain. Number two is difficulty in breathing. Third is seizures or fitting. The fourth is actually vomiting blood or passing dark colored stool. So later we'll go deep dive into each one of these as well. So sudden weakness, numbness, slurred speech, having a very severe headache, accident like after a fall that the person is drowsy or they are confused, persistent vomiting or diarrhea, abdominal pain, high fever with confusion, or even neck stiffness. So these are
Okay.
the 10 emergency warning signs that you always need to present immediately to emergency department.
Okay, got it. So even some of them are like quite mild, right? We won't even think of to come to the emergency kind of thing.
Yeah, correct.
Okay.
Yeah, so some of the symptoms, although it doesn't look mild, but later I'll explain. So until which time that you should come to emergency department. So I'll
Okay.
deep dive into it later.
Okay,
Okay.
cool. All right, let's take a look at the first one. So the first one is chest pain and tightness, right, Doc?
Yes,
So
correct.
yeah. So chest pain, I assume it would be heart problems. And why is it such a big red flag? When should we be worried?
Okay, so definitely I agree with you. When you have chest pain, the first thought in your mind is heart attack. So what we worry about is that when you have a heart attack, acute coronary syndrome or myocardial infarction, is that we have a mnemonic called time is myocardium. That means time is heart muscle. So what happened in coronary artery disease is that there is a blockage of your coronary artery, the artery that supply your heart, and due to this blockage, there is lack of oxygen that actually travel to your cardiac muscle, and because of lack of oxygen, then your heart muscles start to die off, and this can lead to a weaker heart, and sometimes your
Mm-hmm.
heart might stop because of that. So that is one of the reason why you need to be worried about when you have chest pain. And how do this patient usually present? They classical from book is either a central or left-sided chest pain. They felt something very heavy pressing on their chest, and usually lasts about 15-20 minutes and above, and it can radiate to your arm and also to your neck, and usually you have some difficulty breathing or some they feel their palpitation heartbeat very fast as well. So they can have this other type of chest pain that emergency that we worry about. It can be something called as aortic dissection, like in the picture below, where actually due to a weaker wall in your aorta, the blood inside the vessel actually trapped to the wall. So this type of patient usually they present with chest pain that radiate to the back, and usually my patient they will describe that as like tearing type of pain, and it's very severe. Usually they give a pain score 10 out of 10
Wow.
in
Okay.
this presentation. Yeah.
Oh,
Other than that, it can be also due to pulmonary embolism where blood clots block the vessel of the artery. Usually a patient that have some risk factor, for example, they are cancer patient, or they just back from a very long flight, like more than 12 hours flight, or they are having fracture, they are unable to move, so prolonged immobilization. All those are risk factor of a person getting pulmonary embolism. The other one is the pneumothorax, which is the air leaking out from the lung to the pleural cavity. So this one also can be primary cause. Primary cause can be unknown. For example, usually you see this in very tall, thin patient. So they
Thinner.
can have yeah, correct. So there is some disadvantage of being thin lah. So
And
so
here I am trying to be thin.
tall, so so you can the air can leak out from the lung to the pleural cavity, and if you doesn't immediately put in a chest tube to reduce it, then sometimes this air your lung will get collapsed and then lack of oxygen, and then causes your heart to stop due to tension pneumothorax. So these are some of the symptoms that life-threatening symptoms that
Wow. Okay. So chest pain, basically go to the emergency situation because that could be a number of things, not just heart attack, right, doc? And I
yes,
think
correct.
a lot of people, this is what I hear. A lot of people who pass away from heart attack, it's because they go to the clinic first lah, they go somewhere else lah, and it's quite time sensitive, right, doc? Perhaps you can explain more because there is quite a number of situations where I hear they have a heart attack, but they don't know it, and then they go to the clinic, they take their time. What's your advice on that?
Okay. So when you have the symptoms like I described earlier, you need to actually present as soon as possible. Like I told you earlier, the time is myocardium. So by every second pass, actually more muscle is dying off. So if you presented by the onset of chest pain to the time that you arrive to our hospital within the first 12 hours, normally they can do something for you. Every hospital will have a medication called streptokinase where if you present early to the emergency department, and if we do a ECG for you and we notice that there's a ECG changes, there's a ST elevation, so then we will make sure we have a checklist of symptoms that we contraindication that we need to rule out. After that, then we will start you on this medication called streptokinase. Basically what it does is that it dissolve the clots, the blockage to your coronary artery. So that is usually we do this in government settings. So in places like Columbia Asia PJ where we have CAT lab, so when you have a heart attack, so what we'll do is we will prepare you to go for percutaneous coronary intervention where you do a angiogram and angioplasty where you do a balloon or a stent to dilate to reduce the blockage. So that is all very time sensitive. Like we need to actually from the time you present to our emergency to the time that the balloon is open up, we call as door to balloon time. You need to within 90 minutes we should the patient should receive the treatment within 90 minutes. So it's very, very time sensitive.
Wow. Okay, got it. And also from the point of heart attack to send them, first of all, don't send to clinic, right? Straight to emergency, would you say?
Yes, straight to emergency.
Okay.
Yeah.
Do a lot of people make that mistakes?
Yeah, there is a lot of people because they think that it can be due to heartburn or some anxiety related or panic attack or just stress ulcer or something like that. So they did not go to emergency department. And if you present to a clinic where they don't have a ECG machine, they are unable to diagnose you having a heart attack. So they might discharge you with some medication. So that can be dangerous. So if you have a chest pain, all chest pain, you should have a ECG done to make sure that it's not due to heart attack.
Okay, so chest pain, straight away go to the emergency of a hospital, correct?
Yes, correct.
Okay. And how much time do they have, just so that we really understand this?
As soon as possible, but by because like I say, every second counts lah. So by 12 hours, if you present late, after 12 hours, then it depends really on your severity of your symptoms. Do you still have chest pain or not? Are you stable or not? Then, but they can still do the ballooning, the angioplasty for you. But a lot depends on your symptoms. So it's better to present early so that we can save your heart muscle.
All right. So as early as you can. I think I've heard that even them detouring to a clinic first, that costs a person's life, right? That's also possible.
Yes, correct.
Yeah. Okay. Yeah. So as soon as possible. Got it. Let's take a look at the next one. This is the same thing you shared just now, Doc?
Yes, correct. So it's just to highlight that it's very time sensitive, and even in emergency department, when we give the medication from the time that the patient entered the door to the medication is less than 30 minutes. We monitor this as our KPI in all hospital in whole Malaysia. Door to balloon time less than 90 minutes, and within 12 hours, then we'll have these two strategy for you. But if you delay later, then the doctor need to assess, the cardiologist need to assess if you require a
Okay.
percutaneous coronary intervention or not. Yeah.
All right. Perfect. Thanks for that repeat. Okay, difficulty breathing, yeah, doc. Difficulty breathing. How can you tell between difficulty breathing? Because I think some people say panic attack, also like heart attack or difficulty breathing. And how do we know when it's serious? Just wondering.
Yeah, correct. So when we examine any patient, we actually go through the history taking and the clinical examination. So with the clinical examination, you will be able to differentiate, is this pathological cause due to diseases or is due to panic attack. For example, we take the first picture up there when you have a patient with pneumonia, lung infection. So commonly the patient will present with fever, cough, and then they will start to have shortness of breath. And this usually occur like within few days like that. Then when we examine the patient, then when we auscultate with our stethoscope, then we are able to hear crepitation. So that will be findings during on our auscultation. For example, if you have an asthma attack, so they will have like wheezing sound, like a musical sound, like musical sound. Or like crepitation is like just now for pneumonia, then you have some crackles, crepitation, like crack, like the sound during your auscultation. But
Wow.
when you compare it to a panic attack, usually we term that as hyperventilation. This patient, or they will come in very fast breathing, but when the doctor auscultate their lung, is totally clear. That means it's a normal finding, and usually their oxygen saturation is 100%. There are also some other symptoms like they will have perioral numbness or numbness on their fingers or even spasm on their fingers and feet. So usually that can indicate that it's due to hyperventilation or panic attack, but it's a diagnosis of exclusion. So the doctors in emergency, they need to make sure that it's not due to all these diseases that I put inside the PowerPoint. Then only they can say, okay, this is due to panic attack.
Okay, got it. Okay, and for your advice for the viewers at home, when should they come in? Anytime
Yeah, okay.
difficulty breathing.
Yeah, they should, but there are other things that we can see, but you have to train your eye first. Then for example, they will come in very having very fast breathing. But one of the things that you can do at home is that I'm sure that a lot of people, we have bought this pulse oximetry where we put the machine into our fingers to see the
Yeah, yeah,
oxygen
yeah, yeah.
level due to the pandemic
Uh-huh.
COVID-19. So that's one of
Yes.
the
Useful
machine that you can
tools.
use to.
Yeah.
So yeah, correct. The tools that you can use. So if any reading less than 95%, this actually indicate that you have lack of oxygen. So with that,
Okay.
you need to come to emergency department immediately. Another sign that you can see, especially in younger children, is that when a child having difficulty breathing, they have accessory muscle usage. So their rib cage, you can see that during breathing, there will be inwards indrawing of their the intercostal muscle. So you can see that, especially in younger children. So you can, and in older people, sometimes they might be sitting in a tripod position, like in the picture. They will lean forward in a tripod position. So that might indicate that they are having difficulty breathing. So if you have all these signs, then you should come to emergency department immediately rather than visit a GP clinic.
Okay. Again, go straight to the emergency. Don't go to clinic. Okay. Right, Doc?
Yeah, correct.
All right, let's take a look at the next one. Okay, seizures. Seizures is also important, right? What happens? Maybe you can share with us, and what happens if a seizure is too long, and what is considered long?
Yeah. So when a patient, either adult or children, if they have seizures activities for lasting more than 5 minutes, is actually considered something we call as status epilepticus. So this is actually a life-threatening condition that need immediate attention, where normally the doctor will start you on medication like diazepam or phenytoin or phenobarbital to medication to stop the seizure. So it's very important that if the seizure lasted for 5 minutes, then you need to be in hospital. So either by
Okay.
an ambulance or by people sending them, but they need to be there immediately.
But doesn't it take too long when you got to wait for the ambulance to arrive lah and then reach? And how long is it considered that the seizure is long? I know it's more than 5 minutes, but does it
Yeah,
last during the entire trip until you reach the hospital? Sorry,
yeah.
just very curious.
Yeah, correct. If you are at home, you should call the. I think it's quite difficult for you to transport a patient that is still having seizure into your car to bring to hospital. That's why you
Call an
need to call
ambulance.
ambulance so
Okay.
that the ambulance people they can come immediately to
And
your home to.
administers, they can help do something as well,
Yes.
right? Yeah, okay. I
Yeah,
forgot
correct.
about that.
Yeah, correct. Other than the duration of the seizure, other
Mhm,
things that a person need to be worried about is that let's say the person have seizure, but maybe
mhm,
lasted less than 5 minutes, but they do
mm,
not
mm,
regain full consciousness after that. So
mm,
if you do not regain full consciousness after 30 minutes, so it's also considered like status epilepticus. So you need to bring the patient to emergency department. The third one is if it's the first time that the person is having seizure activities, definitely you need to go to emergency department because we need to make sure what is the cause. It can be infection cause, it can be due to accident where there's a bleeding inside your brain or tumor inside your brain. So we need to rule this out. So
mm,
for children, it's also quite common that you can have something called as febrile feet, where the temperature is very high, sometimes like up to 40 degrees Celsius. So sometimes the child can have seizure activities. So usually this happen when they are aged around 6 months to 6 years old. So you need to bring down the temperature as soon as possible, either by suppository paracetamol or tepid sponging, and then you need to bring the child immediately to hospital. Then we can help you and help the child.
okay, very good tips. Thank you, Doc. All right, so that was seizures. Let's take a look at the next one. This one, Doc. Vomiting blood and dark colored stool. I thought dark
Yeah.
colored stool was quite normal, but okay, please, maybe you can share.
Okay, so dark colored stool, we term this in medical, it's called melanic stool. So how to identify this? Usually I'll ask my patient, so what is the color of your stool? Is it like as dark as my hair, black color? So if it's really as dark as your hair and not dark brown, but black color, so that can indicate that it's a melanic stool. And melanic stool can be due to upper gastrointestinal bleeding. So if you see in the picture on the left hand side, so is a black color stool. So on the bigger one, the maroon color is actually something we term as fresh melena. So both these two color actually indicate that there is some bleeding on the gastrointestinal going on. So the another thing that the patient might have is something we call as hematemesis. Either they vomit out coffee ground color type of vomiters or slightly fresh red color. So it can be due to upper gastrointestinal bleeding or esophageal varices if it's fresh red in color. So these are the
Mm,
two warning signs that you need to come to emergency immediately as well.
okay, got it. So it's usually because of those two things, lah. Eh?
Yeah, correct.
Okay, got it. Let's take a look at the next one. Okay, if someone experiences, stroke, weakness, numbness, or confusion, I would have thought it was mild. So how do we know when we need to go to an emergency?
So, having all the symptoms can indicate a person having a stroke. Like just now you mentioned the
Mm,
one-sided weakness where their
mm,
hand and leg they are unable to move or lift up their head. So that is one of the symptoms of stroke. So and if you suspect stroke, then you is something very time sensitive as well. Just like the heart attack. Just now we say that time is heart muscle. So for stroke, time is actually your brain tissue. So the longer you wait, the more brain cell will die off. So you have to present as early as possible for to get treated for stroke. So yeah, so there is this mnemonic here. It's called Be Fast. So normally we use this mnemonic to help us to identify if this person is having stroke or not before their arrival to hospital. So B is being balanced. So some patient with stroke, they are unable to balance themselves. They will have vertigo, where spinning sensation. So that is one of the symptoms. Second is due to E is for eyes. So any vision disturbance, either they have double vision or they have blurry of vision, that can indicate that the person is having stroke. F is for face. So you have like in the picture, you can see that the person have deviation of their face to one side. So that might indicate that the person is having
A
stroke.
stroke. Okay.
Yeah, the fourth one is A is for arm drift. So you ask the patient to just lift up both their arm. If one of the hand is lower than the other one, so it might indicate that the person is having stroke. S is for speech, any slurred speech. If you unable, the patient unable to speak well, then it can be a stroke. So normally you can, what I ask my patient is, I ask the family members, is the patient speech is like that normally? They say no, this is a new to them, then that might indicate that it's a stroke. So T is to time to call emergency, call 999 or present yourself to hospital as soon as possible.
Okay, got it. This is really useful. So, I would highly advise everybody, taking a snapshot and keeping it, right, Doc? You
Yeah,
can
correct.
quickly. Thank you so much. This is very useful. All right. All right. And what about this here, Doc?
Okay,
How long does a
so
person have, right?
yeah, correct. So if a person have symptoms of stroke, you need to present, like I mentioned earlier, you need to present as soon as possible. If you're able to present within the first 4.5 hours after an onset of stroke, the doctors can start you on after confirming that you really have a stroke by a CT scan or MRI brain and MRA brain, they will start you on a medication to thrombolyze, to dissolve the clots. So within the first 4.5 hours. So, but if let's say you delay, let's say you
More
delay
than
going to
4
emergency,
hours.
yeah, we can also still help you. So don't worry, up to 24 hours. In some center where they can do a procedure to remove the clots by intervention radiologists. They can actually insert a catheter to remove the clots in your brain within the first 24 hours. But
Wow.
we also have
Okay.
our criteria, so we'll see the criteria first to see if you are eligible for that treatment or not. So try to
Mm.
present yourself as soon as possible so that we can help you.
Okay. And what happens if it's too long?
If
More
it's
than
too
the.
long, yeah, if it's too long, sometimes because of the lack of blood flow that carrying the oxygen to your brain tissue, so your brain tissue, that area might die off. So if it's too long, then it might affect your neurological function. So there are people like, let's say they delay. I've seen a lot of patients that they delay going to emergency department, to hospital. So
Mhm.
they when they arrive, they are unable to move their hand, and this causes permanent disability to their life, and it really affect the person lifestyle as well.
Okay, so that would be permanent disability. If below 4.5 hours, do they get back all their, their ability to move and stuff like that?
Yeah. So if you receive the thrombolysis as soon as
Uh-huh.
possible, there is a lot of success story. Even in Malaysia itself, we have our stroke pathway in Klang Valley, and also in Penang, and some part of Johor as well. So when you give that medication in a timely manner, you can see that the patient can regain full power after the medication, just like normal. So you have to
Wow.
present
Okay, so
yourself as early as
immediately lah.
possible.
Okay.
Yeah,
Okay,
and you need
so
to know which is the hospital, the stroke capable hospital that can provide you with this treatment. Or so you need to go there.
okay, and you guys provide this as well, right?
Yeah, we can manage stroke
Okay,
as
so
well.
you know where to go. All right. Shall we go to the next one then, Doc?
Yes.
Okay, severe headache. Now, this one I would not have expected to go to the emergency. So, what can you share with us, Doc?
Okay, if you have a mild headache, like example migraine or tension headache or stress headache, that one you can go to general practitioner to see the normal doctor there. But for my discussion is mainly on very severe headache. Like example, for the first picture, the subarachnoid hemorrhage. So usually the patient will complain of pain on the back of their head, the occipital region. So they will have very severe pain with a pain score of 10 over 10. So that type of severe headache, you need to present to hospital because we need to do a CT scan to make sure that there's no bleeding inside your brain. So that is one of the reason that you have. Second one in for the second picture, the on the lower one for the hypertensive bleeding. So if you have a high blood pressure, your pressure is very high, and you are having headache, then you notice that your blood pressure is very high. Do come to emergency immediately because the severe headache can be a sign that there might be a bleeding or a stroke is happening to you. So you need to present as soon as possible. And
Okay.
another differential diagnosis, it can be tumor or any growth inside your brain. So that's why you are having very severe headache that doesn't
Okay.
relieve with your normal treatment or medication.
I see. Okay. So definitely a trip to the emergency. Yeah, doc.
Yeah.
Okay. And what about this? This one's quite straightforward, although some people might not think so. So perhaps you can share with us, doc.
Yeah. Okay. The first one, if you see, there's a elderly gentleman on the floor, right? With the this is actually quite common. So I'm sure that being Asian, most of us live with our parents or our grandparents.
Yes.
So sometimes they do have fall. So if they hit their head, although it's minor, sometimes for a lay person they might think that this is quite normal, just a small bump on the head. It won't cause bleeding. But in an elderly person, let's say elder gentleman, 70, 80 years old, if you have even a small trivial fall, it can cause something called as subdural bleeding inside their brain. This is due to their brain size, due to aging, they have shrink in size. So the vessel there is very easily being tear off during a small fall. So you need to
Okay.
actually do a CT scan to make sure. That's why sometimes when the patient come to our emergency department, when their age is more than 65, we'll say, we'll suggest them, I think better to do a CT scan, although they look well. Another thing is
Mm,
that most of these elderly patients, they might be on medication such as aspirin, all this antiplatelet medication, or if they have
mm,
heart disease, they might be on this medication. All this can trigger a person to have
mm,
bleeding. So easier for them to get intracranial bleeding. So the
mm,
other two picture, the raccoon eye and also
mm,
the bruises behind the ear, we call as raccoon eye and battle sign. So this is a sign of base of skull fracture. So if you see somebody with after a accident, a trauma or a fall with these two sign, then you should ask them to go to emergency immediately. So we will need to do a CT scan to make sure that there's no bleeding or doesn't have any base of skull fracture in that patient.
okay. Got it. So definitely something to not take lightly, especially in elderly patients, right, doc?
Yeah, correct.
Yeah. If they're disoriented, especially lah, kind of thing, right?
Mm.
Okay. So next is persistent vomiting and diarrhea. How do you define persistent that requires emergency case, doc?
Yeah, correct. So it's difficult to make the term when you say persistent, but if I would say that if a person have persistent vomiting, like example, if they are unable to tolerate anything, that means whatever they take in, they will vomit out. Definitely, you require some IV drip or IV medication, or if you have a lot of diarrhea that causes you to be very weak, that you are unable to get out from the bed, then you might need to go to emergency department. But if let's say a person is having dengue infection, any vomiting more than 3 times or diarrhea more than 3 times is already a warning sign. So you should go to
Mm,
see a doctor lah. So either a general practitioner or a hospital to see. But if you are unable to get out from your bed or you're unable to eat anything at all, then you might need to go to emergency department because being too dehydrated, if you don't treat it properly, then it can cause to kidney failure, and even some patient might have electrolyte imbalance where we need to correct your electrolytes.
Okay, got it. Okay, so this one's really important. Be sure to go to the emergency. All right, and abdominal pain, doc. There's so many different types of abdominal pain. So how do we know?
Yeah, so it's a bit difficult so to pinpoint what is the diagnosis unless you see a doctor, because for example in this picture, if you see we in medical, what we do is we divide into 9 quadrant in the abdomen. So and the diagnosis of the problem, the abdominal pain is actually due to the underlying organ underneath that quadrant. For example, the epigastric, the center upper one. So the commonest presentation is due to gastric. A lot of people will know, oh, I'm having gastric pain. So their hand will be on their upper central abdominal region. But when a person presented to us in emergency department, what we need to do is we need to rule out the life-threatening condition. For example, when you have that, it can be also an indication of a person having perforated gastric ulcer. Where their gastric ulcer is so bad that it perforated, and then this food and all those things will go into your abdominal cavity, and this causes very bad infection. Another thing that emergency we need to rule out is called as acute pancreatitis, where a person pancreas is inflamed. So if you don't treat this, it can lead to multi-organ failure as well and sepsis. This is a ICU case. So you need to come to emergency department where we will do a blood investigation called amylase to make sure that it's not due to that. Having epigastric pain also can be a sign of inferior heart attack, inferior wall heart attack, inferior MI. So you need to come to emergency department to do an ECG as well. So there's a lot of differential diagnosis, but if you can see a normal general practitioner first, but if it doesn't work with the medication or you are having very severe pain, then don't delay too long. If you need to come to emergency department, then you have to present early to us.
Okay, got it. Better be safe than sorry. That's what I think, right, doc?
Yes, correct.
Okay, got it. All right, and the next one is okay. High fever with neck stiffness and confusion. What do you mean by neck stiffness?
Okay, so when a person having a high fever with neck stiffness, so it is actually a sign that a person might be having something called as meningitis. Meningitis is a life-threatening condition where there's an infection going inside to your brain lining. So it can be due to bacteria. So we term this as meningitis, or if it's due to virus, then we term that as encephalitis. So their symptoms is actually quite they have a few symptoms like high fever, neck stiffness, headache, and also something we call as photophobia, where when you see sunlight, you feel pain in your eye. So that are some symptoms or signs that can indicate that the person is having meningitis.
Meningitis. Okay. When you
Yes.
say neck stiffness, like how they can still turn, but it's very stiff, or like their neck is stuck. Which one?
Yeah. When they turn is definitely more stiff. So but for doctors, what we do is we do something called as Brudenzi sign, which is in the picture where we actually flex the neck, and the knee will be flexed as well in like in the picture there. So we will confirm with our clinical sign when you have to see a doctor first. Then we'll confirm that is it really a meningitis or not.
Okay, but for us, when you say neck is stiff,
It's stiff. You want when your turn is a
uh-huh,
bit difficult.
a bit
Then
difficult. Okay, got it.
to even bend now. So if you have high fever with that symptoms, then better to come to see a doctor so that we can assess you and make sure that you're not having that sign.
Okay, got it. So we're done with this slide, right? Okay, and then next is high fever with confusion. What about this one, doc?
So high fever with confusion can indicate a lot of things. So this is some of the common infection that I put down here, like dengue, severe dengue, malaria, cerebral malaria, sepsis. But the commonest, if you have a person with high fever and confusion, is we worry about severe sepsis, which is the infection has already gone into your bloodstream and is spreading to your other organs. So if you have a patient with high fever and confusion, you need to bring to emergency or any hospital to have yourself checked, because we need to rule out what type of infection you're having, either a bacteria or virus, or even parasite infection. So whatever, you need to have a doctor to help you to diagnose that lah. So
Okay.
if you have confusion, altered mental status, you have to go to see a doctor immediately, especially in
Okay.
emergency department.
Okay. Okay. And with children, when high fever in
Okay.
children also you mentioned, right?
Yeah, high fever, high fever in children as well. So for example, not all fever that you need to come to emergency department. So normally, if you have if your child have high fever, so don't panic first. So you can start your paracetamol, your antipyretic paracetamol. Follow the timing, usually about 4 to 8 hourly, depending on the temperature. If after the paracetamol, the temperature is still very high, you can do tepid sponging to cool down the patient. But what is the warning sign that when you should go to hospital? If a child is that, example, if the person having very lethargy, very tired, unable to move, normally kids, they will run around and play. If they are just sleeping on the bed, they are trying to ignore whatever you ask them to do. So that is one of the sign. Second
Mm.
is they are unable to eat. So that is a warning sign. Poor oral intake, especially with very young children, like during infancy, more than 1-2 years old. If they are unable to eat with high fever, that can be a warning sign as well. Third is when they are passing very less amount of urine. So how to measure this is if they are on Pampers and their is not very heavy like usual, that indicate that is a lower urine output. So you need to present to hospital immediately. And the more severe one is like if those that have seizure, definitely you need to go to hospital. Or your fever is persistent. Let's say by third day, you're still having fever, you should go to see a doctor, because we will need to do some blood tests to make sure that you're not having dengue infection or some other more serious bacterial infection.
Okay, got it. So this is the fever one, right? Okay, let's
Yes.
take a look at the next slide. All right, so doc, when we are presented with any of these signs, what is it that we need to do?
Okay. So if it's like seizures, or you're having difficulty breathing that is very time sensitive, or you're having severe chest pain, you can call 999. So that is our most emergency response number. So our national one. So they will dispatch the ambulance directly to you. Or you can, if you're staying nearby hospital, I'm sure that most of the Columbia Asia hospital is around the neighborhood. So you can actually
Yeah.
go to the nearest hospital, the emergency department, to get help. So especially those that have the 10 warning sign that I told you, especially those that with chest pain or having your BFAST strokes-like symptoms, you need to
Mm-hmm.
present as soon as possible. So like say heart attack within first 12 hours, you need to present as soon as possible. So by 30 minutes or 90 minutes, we should be giving you treatment already. And stroke within first 4.5 hours. And if latest also by 24 hours, you need to be at hospital, then we can help you. But as soon as possible, if the earlier is better lah, definitely.
Mm-hmm.
The third thing
Okay.
is any information, what are the information that you should give to your paramedic or emergency staff? So I have a
That's a good
mnemonic
one.
here. It's called AMPLE, AMPLE. Your allergy history, the medication that you're on, the past medical history, what time your last meal, and event leading to your illness. So have this information with you always, or your parents or your relative information with you. So nowadays it's quite easy, because we are using handphone, so we can actually key in all these things into our handphone. So
Mm.
if you have anything, you just open up, refer, or pass that to the doctors. Then it will really help the doctor and save the time for the doctor to record back the history. So if you have any allergy, do keep your allergy cards with you as well, because sometimes if you end up in emergency department, you're unconscious or after an accident, so you might not be able to tell us that you are allergic to a certain medication. But if you have an allergy card with you or allergy bracelet, then we know what to do. We will try to avoid the medication that you are allergic to. So these are some of the few tips that I can suggest that if you are coming to an emergency department.
All right. I think this is really useful. What I would highly suggest is take a picture of this slide and keep it, or better yet, print it at your home. And do keep your medical history on standby in your phones as well. What medicines that you use, or especially your elderly, your parents are using. Yeah. Sounds good, Doc.
Yes.
Okay, I think that's all the slide that we have. But I do have some more questions here, Doc. When it comes to, in your experience, are there any incidents that are memorable, or cases that has happened during your watch that you could share, that we could learn from, if you could remember of any?
So I still remember there is a patient that I saw about 1 year ago, elderly patient with
Mhm,
high blood pressure. So she was complaining of dizziness. So but this dizziness is quite bad that she's unable to even get up from the bed. So the family member brought her to our emergency department. So at that time when arrival there, her blood pressure was very high. And then when
mhm,
we assessed neurology, we noticed that the right side of the patient was a bit weaker compared to the left side. And with the
mhm.
high pressure, so we are worried that this patient is having a acute stroke. So we managed to do CT scan and MRI for the patient. Then we because it's still within the first 4.5 hours, so the patient was thrombolized, and you can and what make the doctor feel satisfied and happy is that we able to see the recovery of your patient. So the patient came into my department unable to walk, unable to stand up, but after the medication, when the patient discharged from the hospital, he's able to walk by himself, by herself, sorry. So you feel satisfied, and the patient really, they thank us for helping to recognize their symptoms early, and giving them appropriate treatment. So yeah, that's one of the story that I can share.
Wow, I think that is really very inspiring to hear, and very, very informative. Everybody is sharing right now a great explanation, very informative. So thank you, Doc. We are learning a lot. So I guess, if we were to summarize today's session, what would be some important points that you can share, maybe bullet points that the audience can take home?
Okay. Remember all the top 10 emergency sign that I just shared with you all. Number one. Number two, do not delay going to the hospital if you have all these sign. Number three, don't worry about the doctors or about the staff that they are overworked. If you have all these emergency symptoms, please do present yourself as early as possible to the emergency department so that we can help you.
Okay, got it. If there's one thing they can take home from watching this episode, what would it be?
Remember all these emergency sign. Share this with your loved one, and if you have this sign, please come to emergency as soon as
Okay.
possible.
Thank you. That was like three, but thank you. Yeah, kind of thing. I think, as a suggestion, maybe if we can make the slides available so that people can download it, would be even epic. Something to think about. Yeah. How does that sound like to you guys? All right. So now, you guys had like some questions, right? Let's take a look, so we can look into the Q&A, and then after that, we're gonna go into the quiz. So if you want to win some laptop bags, stay tuned, right? Kind of thing. Okay, let's take a look at the first one. All right, so Maureen had a question, but she said it's answered already. What about sudden stroke can happen? What she means is, can strokes happen suddenly?
Yes, because stroke can happen suddenly. That means we have a lot. I've seen a lot of patients that they were doing their things like normal thing. Then suddenly they will just have a sudden weakness. So that can be due to either their underlying they're having high blood pressure that they did not take their medication, or they may be in a stress that their blood pressure suddenly burst up, so shoot up, so they can have all these symptoms suddenly. Or another common thing is something we call as atrial fibrillation, where you have irregular heartbeat. It's quite common actually. So when the irregular heartbeat will cause a clot formation, and this clot can actually dislodge to your brain and causing a sudden stroke. So it can
Mhm.
happen.
All right. So I hope that answers your question. Yeah. Come is this is not a question, but it's more like a sharing. So come is saying you are born to do this. Your colleague. This is when we were asking about why you got interested into emergency medicine kind of thing. Yep. Next is yes. Chui is also sharing that. Hang on, if you can see. Yeah. So a lot of elderly worry weekend more costly, so they wait until weekday. You see. Only Asians have this belief. I think the Westerns will just straight away go to emergency. Okay. Next question is from Kam. For those never experiencing chest pain, how do we describe the pain? Is it throbbing, sharp, muscular pain? Yeah.
Okay, so for heart,
Great
like I
question.
said, the description might be different in each individual, but the typical classical presentation, if it's due to heart attack, is something heavy or something pressing on your chest. So if you have that, then it can be heart attack. If you describe it as tearing, something like tearing like that, then it can be aortic dissection. Usually, burning type of pain can be due to reflux or gastric related. But if you ask me any chest pain, better to rule out, make sure that it's not heart attack first. Because in some patient, like in elderly group or patient with diabetes or female patient, they might have some atypical presentation. Even some patient, we see them, they don't have any chest pain. I'm sure that if anybody work in emergency, they have a patient like normally classical one is elderly patient, they come to you complaining of whole body pain. So actually, what we do usually, if they complain like that, we'll do an ECG, and you'll be surprised that some of them actually had heart attack. Their symptom is their whole body they feel pain, but it can be a sign of heart attack, especially in elderly patient. So they have a lot of patient with atypical presentation. So you need doctors to help you as well.
Okay, got it. Maureen has a question. Maureen's question is after stroke, how can one get the hand sensation back? I think you shared earlier, but if you could share, and also how long does it take?
Okay, so when a person have stroke, it's not the whole area of the brain will will not get blood supply, because there is also some area of the brain we call as penumbra area. They have small blood supplies to that area. That means there are some, maybe 100%. There's some area that 100% stroke, but surrounding it might be 70-50% stroke, for example. So this small blood vessel can still supplying the area of the brain. So if we able to bring down the blood pressure, we give the thrombolysis. So this area that bit lack of blood supply can heal by itself. So that is why a person can have neurological outcome after the inflammation have subside. This blood flow going back to the area of the brain tissue, so you can get your sensation back. So how long is really depends on the patient. How good is your treatment? Do you receive the treatment early? For physiotherapy, are they compliant to the physiotherapy? All those, and it's different from people to people, so it's a bit difficult for me to say how long the person can get back their sensation. But usually, if you treat the blood pressure, to start the medication early, early physiotherapy, you should get back your sensation earlier.
Okay. Awesome reply. Okay, so this is maybe you can share as well. Ara is saying my daughter experienced the febrile fit when she was 13 months old, really scary, and it happened around 2 a.m. So if this was to happen to someone out there, what is your advice, doc?
Okay, so number one, don't panic first. Okay, so when a child is having seizure, so what you do is you put the child on the left lateral position. That means you put at the side bay on the left side. Okay, this is actually to prevent aspiration of the food or secretion to the lung. Okay, so second thing is, if you have any suppository paracetamol, if the person is having high fever, because the case is febrile fit, right? So high fever, you can give a suppository paracetamol to bring down the temperature. You can do some tepid sponging to bring down the temperature. With that, usually the seizure will stop. So bring the child immediately to hospital so that we can monitor and we can treat the child. So there's also a lot of myth like old people, they will say put your fingers inside your mouth, prevent them from biting their tongue, put some keys at their hands, right? So there are some myth in Chinese people, usually they do that. So all those that doesn't really help lah. So don't worry about that. So just follow this easy. Put the child sideways, bring down the temperature, then bring to hospital immediately. So
Okay.
then we can treat the child.
Okay. So there's a follow-up question from Lynn Kelly. So I'm going to address it at the same time. For babies or children, if they are having high fever, what temperature will they get seizure? Because we always afraid of high fever in babies.
Yeah. Usually it's a high grade fever, 39 or 40 degrees Celsius and above lah. So if they are having very high fever like 39, 40 degrees, you have to be careful lah, because seizure can happen, can be triggered by this high temperature. So around 39 and above lah, 39, 40 degrees Celsius. So usually they
Okay.
can have seizure.
Okay, got it. Right. Let's take a look at the next one. Chia Guat Hua is asking, when is the best time to give diazepam during seizure in children, also related to seizure?
Okay, if the child is presented initially to you and the child is having seizure and you have per-rectal diazepam with you, give it immediately, because the main principle when any patient with seizure is you need to stop the seizure. Other than the airway breathing and circulation, you need to actually stop the seizure as soon as possible. So if you have the per-rectal diazepam with you, give the per-rectal diazepam. In emergency, sometimes it will take some time for us to insert line to give to the child because their vein is quite small, right? So we will usually give per-rectal diazepam to stop the seizure first. Then
I see. Okay.
Then the IV
Okay.
medication.
Okay. And this is readily available for people to buy?
But I think you need prescription from doctors if you
There
have
you
it.
go.
Yeah, but usually at hospital or in nearby clinic, they will have it.
Okay, got it. Do some children actually experience more seizures, or it frequently happens to them compared to other children?
Okay.
Just wondering.
For febrile febrile fit, is let's say the 100% have febrile fit, seizure when they are at 6 months to 6 years old. So 1/3 of them actually can recover fully without any neurological deficit. That means only one time they happen, then they don't have it at all for the next few years. But some people, they will have recurrent febrile seizure, usually triggered by the high temperature. And 1/3 of it, even after 6 years old, they will develop seizure. So that you need proper follow-up with the pediatric neurologist if you have persistent seizure even after 6 years old.
Okay,
And
got
it's
it.
not triggered, especially it's not triggered by fever lah. So you need
I
to have
see. Okay, so that could be
pediatric
another
neurologist.
kind of thing. Okay, got
Yeah.
it. Okay, so since we're on the topic of seizure, Maureen is asking, what is the time frame if seizures happen at home, then to hospital?
You need to present as soon as possible to a hospital, or you call your ambulance because you might not be able to stop the seizure. So even the seizure aborted by itself, you still need to go to emergency department, to hospital, so that we find out what is the cause that trigger the seizure. It can be meningitis, the brain infection that you require antibiotic or antiviral, or it can also be due to bleeding or inflammation in your brain tissue. So you need to come to emergency department, then we can have the facilities of CT scan, MRI, blood investigation to rule out what is the cause of it.
Okay, got it. So basically ASAP, right, Doc? Okay, we're
Yes.
going to take a quick break because we are going to go into the quiz where you get to win some laptop bags. So if we could have the quiz slide, but your questions, we will answer it after the quiz, right? Okay, so let's take a look, kind of thing. So it is now time for the quiz where you get to win a laptop bag. But what do you need to do in order to win? First, you got to be sure to share this video out 3 times. Remember to set the share post to public so that we can see it. Next, answer the 3 questions that we're going to be showing on the screen in a single comment, and you are on your way to win the laptop bag. So let me repeat that. First, share this video out 3 times, and remember to set the post to public. Secondly, answer the 3 questions that we're going to be sharing in a single comment, and we will select the first 3 winners based on speed, and based on the correct answers, basically, in shared post, not based on speed. All right. Okay. So first things first, the first question is, true or false? You should wait 24 hours before going to the ER for severe abdominal pain. True or false? You should wait 24 hours before going to the emergency room for severe abdominal pain. So that's the first question. Second question is, children with high fever and seizures should be taken to the emergency room immediately. True or false? And the third question is, a deep cut that won't stop bleeding needs emergency situation. True or false? Let us know your answers in a single line, and we will select the winners. While waiting for the winners, let's go back to the Q&A, okay? Let's have a look. Okay, so Chua Se Tong is asking, all hospitals provide this treatment for stroke patients? What treatment? He is asking about the removing the clot or the blockage.
Okay, so actually, not all hospital is a stroke capable hospital. So usually you require a neurologist at that hospital, and then you must have a stroke protocol plan. So, but the medication is you can get it for any hospital, but you need to have a neurologist in that hospital. For example, if you in government hospital like HKL, PPUN, UKM, USM, even USM, if you're in Kelantan area, they have medication, and they have neurologists and neurosurgeon, so they can actually thrombolize the patient. And for the removal of clots within the first 24 hours, you need to go to a hospital where there is an intervention radiologist that is very specialized, because you need a very because you're dealing with brain and the vessel and the brain, right? So we don't want any issue. So you need to have an intervention radiologist that is able to remove the clots for you. So another government hospital that is our stroke center now is actually UPM, University Putra Malaysia. So
Okay.
they are our national referral center for stroke, actually.
Okay.
So a lot of people doesn't know about that, so I help them to
Okay.
promote.
Do a lot of government hospitals have the medicine that we're talking about?
They have the medicine, but they are in some places they are not stroke capable center. So what a few of my emergency friends and neurologists they are doing in Malaysia is that they are trying to have this stroke pathway where they allow some of the hospital without the neurologist to give this thrombolysis treatment to the patient. And then after that, they will transfer to the hospital where there's a neurologist. So we are trying to start this stroke pathway, because before this, we actually started the heart attack pathway many years ago. So some of my friends, they are starting this stroke pathway as well. And even Columbia Asia, we are trying to start this stroke pathway for all, because we have a lot of hospital around the community. So if we have this stroke pathway, it definitely you can help to help more stroke patient to give
Okay.
timely medication.
Okay.
Yeah.
Brilliant, doc. Okay. Next question we have from Margaret. So, do we send a choked patient to ER? Example, fishbone which cannot be taken out.
Okay. Yes. Okay. We actually do see a lot of this patient presented with foreign body stuck on their throat after a dinner, especially fishbone. So if you have this foreign body sensation on the throat, because it can be either in your drop to your lung or at your esophagus in your stomach area. So the doctors need to assess first. Normally, if you present to us, then we'll try to see in your oral cavity if the fishbone is still there. If we can see it, then we'll try to remove it. If we are unable to remove it, then we have to refer you to our ENT consultant. So they will do a flexible scope to remove the foreign body. We do see a lot of patients.
Okay, so
do,
it's quite normal, yeah? So, Margaret,
yes,
you know where to go, all right? Okay, kind of thing. All right. So, next question is from Cecilia Lowe. Why do I have a metallic smell in my throat when I get up in the morning? I do have gastric and hypothyroid. And she also has palpitations when doing light exercise, though she has done ECG and it says normal.
okay. So the metallic taste, it might be due to your gastric acid reflux. So if you have that symptoms, or it's better that you do a scope to make sure that it's really due to your gastric. And then normally the gastroenterologist, they will start you on some proton pump inhibitors. Nowadays they have a newer generation, the potassium blockers that can help to relieve the symptoms for longer duration of time. So that might be one of the symptoms. For palpitation after an exercise, it can be a normal thing, because when we do our exercise, our heart actually beat very fast. So you can have palpitation. But how to know, is it normal or abnormal? There's a formula for this. You just use 180 minus your age. So but don't type it out there so that we don't know your age, right? So 180 minus your age, that is your maximum heart rate that you can have normally. Anything higher than that is considered abnormal. But
I
if you have
see.
frequent heartbeat, especially if your heartbeat is more than 150 beats per minute, even with resting, then you have to come to a hospital to see our cardiologist. They will do a test called Holter test, where they will record your cardiac rhythm for either 24 or 48 hours to see if you have any abnormal rhythm. Another thing, you can buy smartwatch, like your Apple smartwatch. They can see you have any atrial fibrillation, irregular heartbeat or not. So they can help this. All these things can help you.
Okay, got it. So we already have a winner, but before I go to the quiz winner section, let's just tackle two more questions here, Doc. Is that right?
Okay.
Okay, so Amira Kamaruddin has a question. What type of emergency can we call 999? Because she doesn't want to exhaust the resource. See? Very, very kind people we have, Malaysians. All right. So, what kind of emergency can we call 999? Or what kind of emergencies can we go?
Okay. All the severe condition that I told you, like example, if a
Uh-huh.
person having difficulty breathing, or the person is unconscious, person having severe chest pain, or a very bad accident, only trauma, where you see the hand is broken, the leg is broken, or a person is unresponsive at home. So all those are some of the symptoms that you can call 999 to get help. So if, let's say, example, you doesn't know that is this symptoms require ambulance or not, you can still call 999. The
Uh-huh.
medical assistant there, they have a set of questions that they will ask, and they will triage you accordingly to your call, to your emergency. Then if it's really needed an ambulance, then they will dispatch the ambulance to your home. If not, they will say,
Mhm.
okay, this is look like a mild symptoms, you can actually come to hospital yourself.
I
They will
see.
they will
Okay.
advise you accordingly. They even will tell you, let's say example, you have a very deep cut, actively bleeding, the question just now. So
Uh-huh.
how you control the bleeding, they will teach you how to do it in the phone.
Okay.
They're supposed to teach
Okay.
you.
Fantastic. And if they send you the ambulance, where does the ambulance take you? Is it the nearest hospital?
The nearest hospital, they are supposed to bring you to the nearest, most appropriate hospital.
Okay.
Sometimes it's a bit difficult. Let's say, like, I have, for example, I have insurance myself. So if I call an ambulance 999, sometimes the government ambulance, the medical assistant, they might more reluctant to send you to another hospital. But you just tell them that you want to go to a private hospital, you have insurance. Just reassure them, don't worry. Then they will bring you there, because for them, they are just following the order that they need to bring to the nearest hospital. So usually they'll bring back to government hospital, because they are from government, right? So they'll
I
bring, but
see.
there's
Okay.
overcrowding in government hospital. So
Yeah.
if you have insurance, then better to send them to private hospital.
Okay.
The nearest,
All
most
right.
appropriate hospital. Yeah.
Okay, got it. So that's really good information for us. All right, last question from Kam. This one I think have to ask because it's very typical Asian Malaysian question. So Malays tend to use the word angin all the time. When is this an alarm? And do people go to the emergency for angin or bloating situations? Just wondering.
So we do see patient complaining of angin lah. So mostly is like reflux symptoms, gastric. They feel bloatedness on the abdomen. These are some of the description that they say. But yes, we still need to make sure that it's not the life-threatening condition. Like just now the slide in the abdomen. So we have a lot of emergency. Okay, for example, maybe I can share another one is that if you have persistent vomiting, your abdomen feel bloated or you have angin and you're unable to pass motion. So that is an
Mm,
emergency clinical condition that you need to present yourself immediately to emergency department because it can be a sign of intestinal obstruction. I do see quite frequent patient coming in with persistent vomiting, abdominal distension or bloatedness and unable to pass motion, and it turned out to be intestinal obstruction due to their bowel strangulating. They don't have blood supply to their heart, so the intestine is swollen. So that is an emergency situation that you need to go to emergency department immediately.
okay, so don't take that lightly. Do go, especially if it comes with vomiting. All three symptoms at the same time?
Yes.
Okay.
Usually they present with that three symptoms together.
Okay, got it. All right, cool. So thank you very much, Doc. I think it's time that we go to the quiz section. Thank you so much for your questions as well. Yeah. So, Doc, we already have our winners, but let's find out what the correct answers are. Yeah. So if you can help me with the right answers. So, question number one, you should wait 24 hours before going to the emergency room for severe abdominal pain. Is that
Uh,
true or false, Doc?
False.
Yeah, go early, don't wait.
Yes, as
Okay.
soon as possible.
Yeah, because more than 24 hours, that could be the end. Okay, let's just put it that way so that you understand how important it is. Number two, children with high fever and seizures should be taken to the emergency room immediately. True or false, Doc?
Yes, this is true, definitely. So you need
Okay.
to bring them immediately to emergency.
Yes, definitely. And the third question is a deep cut that won't stop bleeding needs emergency attention. True or false?
True as well. So you need emergency attention by a doctor to how to stop the bleeding lah. Usually the first aid lah, you can actually direct compression and pressure to the wound to try to stop the bleeding. If you are and try to press it about 5 minutes to 10 minutes like that. If you're unable to stop it, then you better go to the nearest clinic or hospital to see us.
All right, got it. So thank you, Doc. So the answer is false, true, true. Okay, now, so for the winners, who are our winners? Let me find out for you. All right, so the winners are who get to win a laptop bag is Majoyce Radovan Medina, Ling Mei Fang, and Margaret Su. So congratulations, yeah. What you have to do is just stay tuned. Make sure you are online. Be sure to check your message because we'll be reaching out to you via your Facebook Messenger to let you know how to get your laptop bags. All right. So be sure to answer the question. Next, I have put up here Margaret is asking Nina, will this talk be recorded or played for us to share with others who didn't tune in? Yes. What happens is that you're tuning in live after this. The video will remain on the Facebook account that you're tuning in, and you can easily share it with your friends and family. Just get the sharing link lah. Okay. So because it's very informative, Doc. So everybody is saying awesome. It has been really informative, and feel free to share it out with your people. Yeah. So thank you so much, Doc, for all the time.
Thank you so much for
Yeah.
inviting.
Very, very informative. You're definitely doing what you love in your calling. We can all agree with that, right? Now, if you find this episode really useful, if you or you learned a thing or two, if you know someone who's going to appreciate the tips, info, and insights, please feel free to share this video or tag them. All right, because it's definitely going to make a difference. So thank you so much, Doc. Give us a lot of likes and love while you're at it. Thank you again. Till our next episode of Doctors Go Live. I'm Nina Shara Khan saying thank you with Dr. Jonathan Yeap. Yeap as well. So please take care of yourself and each other. Thank you.